Welcome everyone to Foundation Fighting Blindness Proposals Day presentation. I'm Preeti Subramanian, Vice President of Preclinical Research at the Foundation. At the Foundation, our Grants and Awards program provide annual support for a wide range of research from basic science and lab-based studies to early translational, clinical, and preclinical work. This research spans across inherited retinal degenerative diseases and age-related macular degeneration. Our goal is to find the causes, preventions, treatments, and cures for retinitis pigmentosa, macular degeneration, and the entire spectrum of retinal degenerative diseases. The circular representation provides an overview of the Foundation's research programs. There are 7 programs, and today I'll talk about some of the grant opportunities that fall within these programs. At the top center is the individual and multi-center grants to support clinical studies and preclinical research, and the Individual Investigator Research Awards that is currently receiving application falls under this program. The Britt Family Translational Research Program on the top right side is designed to accelerate preclinical research towards a regulatory filing or the launch of a clinical trial. If you are interested in learning more, I encourage you to watch the Proposals Day presentation by my colleague, Dr. Chad Jackson. That said, the application deadline has passed for this program for the current cycle. The next on the right, we have the Career Development Award that provides support for early career scientists for a career in retinal research and clinical care. This year, we have a new grant opportunity for Postdoctoral Award, and we are also receiving applications for the Clinical Research Fellowship Award. On the right bottom is the RD Fund, the Foundation's venture philanthropy fund that drives therapies towards clinical trials. Moving on to the left bottom here is the patient registry that provides no-cost genetic testing and counseling to individuals who have a clinical diagnosis of inherited retinal disease. And at the top left is the clinical consortium. The foundation supports 40+ clinical centers, and the goal of both the registry and the clinical consortium is to accelerate the delivery of therapies for IRDs by identifying their causes and prevalence. We are also committed to fostering collaboration across the research community, promoting research and helping people efficiently connect with relevant clinical trials. The last program on this chart is the resources, and I will be talking about the Targeted Call for Disease Model Awards, which is a new funding opportunity. The funding decisions are made through a competitive peer review process, so only proposals that demonstrate the highest scientific merit are considered for support. You can see our percent funding allocation on this chart for the preclinical programs, the Career Development Program, the Individual Investigator and Multi-Center Grants, the Britt Family Translational Program, and resources that include the Disease Model Award Program. The Foundation has identified 6 research priority areas that are closely aligned with our mission. These are cell and molecular mechanisms of disease, clinical structure and function, novel medical therapies, genetic technologies, genetics, and restorative therapies. What you see here is a breakdown of our fiscal year 25 preclinical funding across these priority areas. In the next few slides, we will take a closer look at the priority areas and their specific objectives and focus. To give a brief overview of the objectives of the 6 priority areas, we also encourage applicants to address one or more of these 6 areas in their application. You can read detailed description of the areas of interest for these priorities. These are available on our website. So for the research priority area of genetic technologies, the objective is to develop viral and non-viral delivery systems and also to develop RNA editing techniques. For the restorative therapies, the goal is to restore sight after photoreceptor loss by developing strategies to rescue or replace degenerating or dead retina cells, and to optimize visual prosthesis and optogenetic strategies to confer light sensitivity to neuronal cells when photoreceptors aren't fully functional. The goal of novel medical therapies is to support research for developing drugs to retain retinal function and structure, and to improve functional testing of drug effectiveness, and to develop novel drug delivery systems. For clinical structure and function, the goal is to develop improved technologies for establishing the relationship between retina function and structure to enable early disease detection. And we encourage applicants to utilize the Foundation's clinical consortium to expand patient populations and expedite clinical trials. The goal of the research priority area genetics is to identify disease-causing mutations in inherited retinal disorders and inherited risk factors for age-related macular degeneration, including contributions from non-genetic factors such as lifestyle, in order to develop treatments and prevention. And the last priority area, which is the cell and molecular mechanisms of disease, aims to improve our understanding of the nature and cause of disease in inherited retinal degeneration and dry AMD, so that improved therapies for prevention of vision loss can be developed. To give everyone a snapshot of our fiscal year 25 grants and awards, last cycle we received 173 letters of intent across all funding opportunities, and we invited 16 full applications. To highlight, the Clinical Research Fellowship Award received 2 applications, and we gave 1 award in this category. For the Individual Investigator Award, we received 77 letter of intents, and we invited 22 full applications and awarded 7 new awards. We fund researchers globally in 16 countries, as you can see on the right here, and there is also no requirement for US citizenship. The countries listed here also include our support for clinical consortiums around the world. So there are 4 funding opportunities that are currently receiving applications, and I'll highlight those in the next few slides. The Individual Investigator Research Awards are designed to support research in areas with the greatest potential to move towards treatments and cures for inherited retinal degenerative diseases and dry age-related macular degeneration, particularly early dry AMD. This award will be approximately $100,000 per year for up to 3 years. This targeted open call for proposal is to address specific gaps that are identified in current retinal disease research. Individual research awards are available in the 6 priority areas that I mentioned a few slides ago. The due date for this call is October 16th for the letter of intent. And you can use the QR code to go to the page with the guidelines and other information to submit the letter of intent. The Disease Model Program is a new funding opportunity to support innovative research focused on developing and validating cellular and or non-rodent models. One of the major challenges we face in translating preclinical research into effective clinical therapies is the lack of cellular and non-rodent animal models that truly reflect human disease. This gap continues to slow progress and limits our ability to predict how therapies will perform in humans. So we are inviting proposals for our disease model program focused on inherited retinal degeneration and dry AMD, including proposing new models for genes that currently don't have any models. These models will be critical tools for therapeutic development, biomarker validation, drug screening, and mechanistic studies, ultimately helping us move discovery to clinical trials. We also strongly encourage applicants for this program to collaborate across disciplines. Talk to colleagues in other scientific areas or disease fields. Sometimes the best ideas come from outside your immediate focus. This award will be approximately $300,000 to $1 million, totaling from 3 to 5 years. And the deadline for the letter of intent is October 16th. The Postdoctoral Fellowship Award is also a new funding opportunity intended to support the training of postdoctoral fellows engaged in innovative research projects focused on inherited retinal degenerations and dry AMD. The award will be $80,000 per year for a period of 2 years. This targeted open call for proposals is also to address the specific gaps identified in current retinal disease research in the 6 priority areas. The letter of intent for this program is due October 16th, and one of the eligibility requirements is that applicants must hold a doctoral degree or equivalent that is earned within the past 5 years. The last program here is the support for clinician scientists in their first or second year fellowships. The Clinical Research Fellowship Award program provides 1 year support for aspiring clinician scientists interested in inherited retinal diseases. The intent of the CRFA is that the recipients can become certified by the American Board of Ophthalmology to provide care for patients in the US at the end of the fellowship. The 1 year award is for $65,000, and the deadline for application is October 16th. Note that this doesn't require a letter of intent. This slide shows the timeline for our review process. For the Clinical Research Fellowship Award, we accept full applications, which will be reviewed by our Scientific Advisory Board, and the applicants will be invited for interview and notified of the decision at the beginning of January 2026. For the other 3 programs, the letter of intent is due October 16th. Following the letter of intent review process, applicants will be notified of the decision, and invitation to submit full applications will be sent around mid-December. The due date to receive full application is March 6th of 2026, and the applicants will be notified of the final decision by the end of June 2026. So I want to close by giving a few tips for grant writing. So one of the first point is clearly define realistic and specific goals for the project. For example, if you're applying to the Individual Research Award program, applicants must propose a research plan that is both realistic and achievable within the 3-year time frame and the $300,000 budget of the program. Propose research models, example, cell lines, animal models, that accurately mimic the disease pathology being studied for better translational outcomes. The proposal should show a well-structured plan that emphasizes feasibility and impact of the study. Tailor your application to show how the project directly aligns with the funding priorities and mission of the foundation. Prepare a well-justified budget that is appropriate for the scale and scope of the proposed project. Use plain and straightforward language and avoid jargons to make it easier for the reviewers to read the application. Your proposal should have a clear and engaging narrative, highlighting the significance and potential impact of your research. Don't work in a vacuum. Ask trusted colleagues and mentors to review your draft. Their feedback can provide fresh perspectives and help you strengthen your proposal. Include letters of support from your collaborators and mentors. Especially for postdoctoral fellowships, these letters are particularly important as they attest for your potential and qualifications as a candidate. Allow plenty of time for internal review process at your institution so as to avoid any potential delays in submitting the application. And with that, I want to thank you for your attention. And if you have any questions, you can use the chat feature, or please submit them in the Q&A, or you can even use the raise hand and unmute and ask the question. And you can also email us anytime at grants@fightingblindness.org with your questions. And I'm joined by our science grant specialist at the foundation, Liala Kenny, to moderate the Q&A.
I wanted to add one thing, Preeti. I think you mentioned that the clinical research fellowship applicants would be notified in January. They will be notified in early December of this year.
Thank you. Yeah.
Okay, we have one question in the chat. On the clinical side and modeling, would an imaging-based model in silico be considered for the disease model funding scheme?
And I also want to add that Dr. Amy Laster, our Chief Scientific Officer, has also joined us for the panel. Welcome, Amy. Yeah, so yes, absolutely. Imaging based model will also be considered. It depends on the question or the question the model will be used to address for the disease. So as long as the imaging in silico model can answer disease model or disease relevant pathological questions, yes, that would be considered for funding scheme.
Thank you. Okay, the next question, for LOI postdoctoral fellowship awards, do we need any institutional approval / signature?
Not at the LOI stage. We do not need a signature or approval because there is no budget required at this stage. But when we invite for the full proposal, that is when you will need the approval from your institution.
That is the only questions in so far. Feel free to use the raise your hand feature if anyone wants to ask a question that way. Oh, we've got one question here. Let me click the button. Okay, go ahead once you unmute.
Can you hear me?
Yes.
Okay, great. First, I'd like to say hi to Amy. It's been a while. I have a question about, we have a proposal that actually ticks several boxes in terms of your priorities. Is that an advantage, or should we focus on one particular priority?
Hi, Janice. I'll address that, and Preeti, feel free to jump in. So it depends on what is the question that you're trying to answer. So, for example, if you are looking at immunological triggers in a cell-based therapeutic strategy, like that addresses two of the priorities and they're related and connected. I would not try to force a proposal to address multiple strategies, just to address multiple strategies.
Okay.
Does that help?
Yes, that does help. Thank you.
Mm-hmm.
You. All right, how many postdoctoral fellowship awards will be given in total? And I believe we have funding for up to 2. Next one is, what is meant by stage of development on the LOI submission?
Go ahead, Preeti.
Yeah, so that refers to whether the work is early preclinical, mid stage, or late preclinical stage of development that you're proposing.
And if you need additional clarity, if that didn't answer your question, then again, feel free to come off mute. And I could just add, even for stage of development, I mean, really what we want to understand in thinking about the work that is proposed, you know, this is a novel idea and you want to get this off the ground, and so it's an early kind of stage because it's a novel idea, versus something that's like, I really need to answer this question because I'm really moving toward translational research, and that helps in terms of thinking about the correct budget size and then even the work that is being proposed. So whether you're including developing particular disease models and characterizing those, like to really help you have a sense of how this funding will move you to the next stage of development of your idea.
It says, please make slides available if possible. Thank you. We will be uploading this presentation and the slides to our website and then sharing by email to everybody who registered here. Thank you. For the postdoc award, should we include a CV of the candidate or the PI?
So for the postdoc award, the candidate would be the PI submitting the application. So yes, we would need a CV along with the application for the PI, and if possible, also for the mentor.
Right. Go ahead and come off mute.
I have a quick follow-up question to that. So for the PI, it mentions to like do an NIH bio sketch. For the mentor that is supporting the PI, would they also need to have an NIH bio sketch based on like what was just said about like the mentor CV?
Yeah, if most mentors and PIs have a bio sketch available in the NIH format. So if that's available, that is great. You can add that. But if not, then whatever format they have their CV bio sketch in, you can include that.
Okay, so it's not mandatory to have an NIH bio sketch, but it's preferred.
Right.
Thank you.
We have a question through the Q&A. Could you submit 2 LOIs for both the disease modeling and the Individual Investigator Award for the October deadline?
Yes, you can submit LOIs in both programs, and we would recommend that you propose non-overlapping aims in those proposals, so that if you receive funding for both awards, then there is no overlap of specific aims. But yes, you are eligible to apply to LOIs in separate programs.
I would add that because they're the same mechanism, you'll need 2 separate emails to submit those, because you're not able to submit 2 for the same mechanism using the same email. Is there any other questions? I'm not seeing anything in the Q&A or the chat. You can always submit more questions at the grants inbox. It's grants@fightingblindness.org.
Thank you both, Preeti and Leila. Again, if anyone have any additional questions with regards to the program or your submission, do reach out to us. We thank you for your interest in the Foundation Fighting Blindness and our granting programs. Give it over to Preeti for last words.
Yes, thank you, Amy. Thank you, Leila. Thank you, everyone, for joining us today. And please feel free to reach out to us with any questions you have with the submission process or the programs.
Thank you.
Thank you.